information through a presentation, and then we'll open it up for questions. We have received some questions via email, so we'll start with those and then take others that come in. We are working to make these meetings more accessible to people who speak other languages. So one of the ways we're managing that right now is through closed captioning. So if you go to the closed captioning icon at the bottom of the screen and you right click it, a menu will come up. Then you click on translate into English, and that will give you a language selection. So then you can choose the language that you'd like it translated into. Well, the translation is imperfect. We're hoping that it at least helps us be able to reach more people and make it more accessible for people. We also have someone here to help translate questions for people who are Spanish speakers. Nadia?
Yes. Good. Buenos días. Mi nombre es Nadia Ugarte. Bienvenidos a la reunión de autoayuda y reunión familiar de DSPD. Les estaré ayudando a traducir preguntas que tengan durante o al final de la presentación. Si tienen preguntas, pueden escribirlas en la parte derecha de su pantalla. Presione el cajoncito de abajo, por donde está la hora, o mándelas también a nuestro correo electrónico dspdinfo@utah.gov. Para esta presentación, usted puede prender los subtítulos en español. Para hacerlo, presione el cajoncito que está abajo, que tiene las dos C en la parte de abajo de la pantalla. Presione English y saldrá un menú en el medio de la pantalla. Presione Translated Captions en la parte derecha para que el cajoncito se ponga azul y tenga una aspa. Presione la flechita en Translate to y seleccione Spanish. Luego presione la X otra vez en la parte de arriba. Esta reunión está siendo grabada, así que les pedimos que presione el botón rojo en la parte de abajo, donde está el micrófono, para así no grabar ruidos fuera de la presentación. Si tiene preguntas y está usando su computadora, puede presionar el botón que tiene en la mano y presione el micrófono para poder escucharlas. Gracias. Back to you, Annie.
Thank you, Nadia. Also, just as we're getting started, we want to make sure you know this meeting is being recorded, and it should be available Friday on the DSPD website under the Individuals and Families tab, and then the Be Informed and Be Involved heading. And also just please mute yourself and type questions into the chat box or email them to dspdinfo@utah.gov. You can also raise your hand. The muting is really just to kind of help manage like background noise and feedback so that everyone can hear and participate. Nadia, did you already say that part?
Yes, I did.
Okay, I thought so, but anyway, okay, thank you. So our meeting today, we're going to go over, we'll just have some announcements. We'll go over staff changes. I think we'll have Donovan here to give us an ombudsman update on the disability ombudsman. We'll give some updates on legislative, like our response to legislative decisions, and then community resources and a Q&A. So we'll go ahead and start with our announcements. I think for people in services or families when you've had like one-time respite, just making sure you guys all know we have a new fiscal agent. You probably all already know that Leonard Consulting is no longer contracting with DSPD. But we are back to 4. So our new provider is Premier FMS. And then we still have Acumen, Morning Sun, and Valentine, all providing fiscal intermediary services. We also wanted to make sure you knew we've been working to gather information about caregiver compensation. So you should have seen a survey come through your email about it. We're like the time period for responding has closed. But I just also wanted to say thanks to everyone who took time to fill it out. We're working to analyze the responses now, and then this information will be shared with partners like legislators and advocates so that they can make informed decisions about caregiver compensation. And I know many families have been interested in kind of like what they can do. As always, if you're interested in getting involved in legislative issues or advocacy, we recommend you contact one of the advocacy organizations. So the Utah Parent Center, the Utah Developmental Disabilities Council, and the Legislative Coalition for People with Disabilities all do advocacy on behalf of people with disabilities, and that information is just being shared in the chat, so you have that. We also want to let you know about a tool that's going to be available. It's called My Vision of Adulthood. It's one of the resources that we've been developing in partnership with the National Center on Advancing Person-Centered Practices and Systems. It's a guide for a person with a disability, family members, school staff, and teachers, as well as state departments. And it's intended to help as a resource for transition-aged students to help them prepare for adulthood. So this is being finalized, and once it is available, it'll be on our website, and we'll share more about that in our October meeting, but just wanted to make sure you know about it. Then I'm going to give a minute to Penny Scow to talk about some internet safety training.
Yes, thank you. I just wanted to announce that we're putting together 2 training programs to address safety on the internet. One will focus more on general internet and computer safety. The other will focus more on online dating and relationships online in general. We'll have recorded versions available on the DSPD website, hopefully by the end of the month, and looking to possibly do live versions of the training in the future. So stay tuned for announcements on that. And if you have any questions about the training or need help accessing the training, you can reach out to me. My email is there, pennyscow or pscow@utah.gov. Thank you.
Thanks, Penny. I'll just go over some staff changes that we've had in case you need to know who to reach out to. You can see them listed there as well. So Bryn Peterson, he's now our employment planning and inclusion administrator. So like how we're managing integration, if you have questions about things along integrating settings, EPR, he is a great resource to contact. Lisa Wade is also a great resource. She's recently started and she's supervising our employment and planning team. Pam Madsen is currently a new staff on our RFS committee. That's the committee that reviews requests for additional services. That's what the RFS stands for. Luann Jones, she is on our intake and waiting list team. She's working on intakes and waiting list. Brittany Quintana is also on our intake and waiting list team. Janet Hellickson is our caseworker on our community transitions waiver. That's the waiver for people who are transitioning from an intermediate care facility into the community. Mia Risa is a caseworker. So she's on the team that helps people transition from the waiting list into the community. And Amanda Barr is now supervising the team that helps people transition from the waiting list into the community. So I figure those are all names for you guys to know in case you need to get a hold of someone or have a question. And I just want to add, I feel super lucky. We have had great candidates, and we're super lucky to have families with lived experience who are in this group. And I think that really helps keep us focused on families and peoples we serve and kind of just keep that perspective. And they bring so much experience, insight, and talent with them. Really everyone who I mentioned does. So we're really grateful to have them all. Now I think I'll just give some time to Donovan Bergstrom. He'll just give us an update on the progress of the Disability Ombudsman.
Well, thank you, Angie, and thank you for the invite today. My name is Donovan Bergstrom. I'm the Director for our new division with the department, the Division of Customer Experience. And I have all of our department ombuds program in my division. So that's long-term care, it's child protection, and our new ombuds program for people with disabilities. I was hoping at this meeting today I would be able to make an announcement that we have our office director, we're ready to start, but we're getting very close. So I have a interview next week for a potential director of disability ombuds, where that person would be in charge of number one, establishing the program for the department, creating our scope of work, and also putting this into our administrative rules. One thing that we will be doing once we have our person hired, we will be meeting with stakeholders to talk about the scope for the initial rollout of this ombuds program. For those of you that are aware of the report to the Health and Human Services Committee on this ombuds program, originally the recommendation was 20 staff, 2.1 million. I think, Angie, it was somewhere right around there for this big team. We were budgeted for one person, and we know that this is just a starting point, but it is a great place to start. And so that's where I feel like the stakeholder meetings is going to be very important, to identify that scope of where we can start this program with one person in this position. What questions does this team have for me? Angie, I don't think I was that eloquent in my proposal, so.
Or you were so eloquent that you covered it all. Right? So thank you so much, Donovan, for joining us. And obviously, if you guys have questions later, we can get them to Donovan as well and get answers for you.
Yes, and I really look forward to meeting some of you in person and possibly at these other engagement meetings that we will have.
Wonderful. For our legislative updates, we're going to have Jamie Douglas update us on waiting list transition, the funding we had for that, as well as how ARPA can be doing some one-time stuff. So Jamie Douglas. Okay, I'm going to give her a second because we're having some internet delays, so it could be a second. Jamie, if you're speaking, you're on mute. Okay, and Jamie cannot get off mute. No problem. I'll go ahead and share Jamie's information.
Angie, you're muted.
And now I muted myself. Okay. Thanks, Emily. Okay, so our waiting list team has been requesting updated psychological evaluations for people who have been approved for funding. This helps us make sure we have all the required records and make sure we're able to get all the right services in place for people. And we're assigning around 50 to 70 evaluations to our contracted psychologists each month. And then the transition and assessment team and the limited supports waiver teams. So they both are moving people off of the waiting list. One goes into like the community supports, ABI waivers, or the physical disability waiver. And then the others go into the limited supports waiver. That's the newer waiver that just started at the beginning of this year. Officially is when we got approval from CMS. We had been doing a smaller group with state funds for like about a year before that. So, but they are really busy opening cases. We have about 22 cases assigned already for August. And we'll just continue to assign cases. We're typically getting them assigned the first week of each month. So if you've been selected, you'll receive a packet via email with information about completing the Medicaid enrollment through the Department of Workforce Services, assuring informed choice of services through the home and community-based services, intermediate care facility, or the Utah State Developmental Center. So it basically says I'm selecting home and community-based services rather than an institutional setting. It's making sure you have that choice. There's a form on health insurance portability and accountability, so the HIPAA compliance, and then it'll have a document for your person-centered profile. If you have questions, we have an email. It's DSPD WL, so waitlist, transition@utah.gov. We'll put that in the chat for you guys to follow as well. So our team can help you through this process if you need it. Your case will transition from your waiting list worker to a state support coordinator, and your state support coordinator is going to administer some required assessment. One is called the Utah Comprehensive Assessment of Needs and Strengths. It's also referred to as UCANS. Another is Charting the Life course. It's a person-centered planning tool. The other is an employment pathway tool, which is part of also person-centered planning. Developing an initial person-centered plan, and then developing your services budget based on your needs. And then you'll find a provider and an external support coordinator to manage your case long-term. Your state support coordinator is going to help inform you of what is referred to as an invitation to submit offer. That's what we send out to let people know you're ready for services. It lets our contractors know the services that you're looking for geographically, where you're looking for services, so that then people can respond to that. So the state support coordinator will help make sure you're informed of that process, support you in choosing your provider or getting set up with self-administered services if you go with that. They'll get those in your plan. Make sure there's a team meeting with you so that you have your goals and your plan is ready to go. And then they'll do that process with the support coordinator as well. And then your case will be transferred. So that's what that overall process looks as you're coming into services. So that should give you an idea of what to expect. And then on waiting list services, so one of the things that we're using our home and community-based American Rescue Plan Act funding for is to be able to get some one-time services to people who are still waiting. We're waiting for final approval on what the amount looks like, but we know that we're going to be able to use it for this purpose, and that we'll be able to do it over it's probably about a 2.5-year period at this point. So we're really excited to have these limited services available. They're going to be available. So even with this funding, it is limited. So we don't expect being able to get one-time services to everyone on the waiting list, but we do feel like we'll be able to get it to several people. Some of the services that are going to be available include assistive technology, behavior services, transportation services, employment services, caregiver compensation, and respite. We figure at least 1,200 people will be able to receive these temporary services. And it'll be done in 3 groups, right? Over the 3, we'll have it in kind of 3 12-month periods. So July of 22 through June of 23, and then July of 23 to June of 24, July of 24 to June of 25. We'll notify the first group of people to receive these services as soon as we get final approval, and we'll have a caseworker contact them. And just to kind of go over selection, 1/3 of the people will be selected based on having the highest needs assessment score. 1/3 is going to be randomly selected, and then 1/3 is going to be selected based on how long they've been waiting for services. And then this group was split evenly across age groups of 0 to 12, 13 to 21, and then ages 22 and up. So now I think, do we have Brittany Martinez on? We have some community resources. We have Utah Pride with us to share resources that they have.
Hello, are you ready for me?
Yes.
All right. Well, thank you for letting me be here this morning, afternoon. Let me just give you a little background on me. My name is Brittany Martinez, she, her pronouns. I am in charge and oversee all of the adult programming here at the Utah Pride Center, as well as oversee the community health work. So it's resources for the LGBTQ community, like rental assistance or food insecurities, those kinds of things. But today I'm supposed to be speaking on our neurodivergent support group. So I came on the Pride Center in January with being told the goal is to create more identity support with intersectionality when it comes to the LGBTQ community. And one of the biggest intersectionalities is neurodivergence, humans on the spectrum, humans with ADHD. Really, it covers a wide range of diagnoses and experiences. So let me share. Am I allowed to share? I'm just going to share my flyer real quick, if that's okay.
You should be able to share. If you can't, let me know.
Dun, dun, dun.
Marcy may just have to stop sharing first.
Oh, because you're screen sharing. You're right. All right, let's see.
Now you should have a choice.
Okay. Dun, dun, dun. Maybe if I can find it.
So it's the little box with an arrow.
Oh, yeah.
Word?
No, I'm
Okay.
trying to find that. There's like 4 share options. So let's see.
Oh, okay.
Window. Dun, dun, dun. Attack. Oh, you know what? I think it's only going to let me share. Let's see if I can share my entire screen, and we'll just do this. There. Can you see it? No? Yes?
Now we can.
My flyer?
Yeah, it
Yeah,
just took
wrong
it a
one.
minute.
There we go. Okay. So we started a neurodivergent
Yes.
group just because there was one of the largest demographics that we had of intersectionality. And I think there is a lot to be said for LGBTQ humans experiencing neurodivergence. Neurodivergence on its own is a very unique experience. I think adding being queer on top of that complicates things a little bit. And I think that there is a large portion of humans that are looking for support in this particular demographic. So we started the neurodivergent group. It was a slow start at first, but now we're up to, I think, 10 to 15 humans that attend this group. We do offer it both online and in person. So it's a hybrid group just because we want to be accessible to everybody. So that's an option that we have as well. I will say, so it runs Monday nights at 6. And when I first started facilitating it, I will say it was a little overstimulating being neurodivergent myself. However, it's been such a great space for different intersectionalities within the queer community to bond over neurodivergence. And so, for example, on Monday, we talked about if the idea that growing up with neurodivergence or just kind of existing in the world, there's a lot of stigmas that come with it, and you're told that you're too loud, or that you can't pay attention, or that you're lazy, or like all these different like aggressive traumas that come up with it. And so instead, to switch the narrative, we decided to do a project where we turn our neurodivergence into like a superhero. So if we were a superhero based on our neurodivergent quirks, what would those superpowers be, kind of, if that makes sense? I'm going to stop sharing now because I think you saw enough of the flyer. Anyways, which turned out to be a really great conversation. And we did get to dive into that. Like, these are the things that people have been telling me my whole life is wrong with me. And instead of that, we're embracing that from a superhero perspective. And it went really well. And I think we had really good conversation. So that's basically what the point of the neurodivergence group is for us, is to create an extra layer of support for those humans who are existing in a world that isn't always friendly to them. So that's kind of my soapbox about my support group. Are there any questions about it, or when it runs, or anything like that? Please, not everybody at once, one at a time. I'm just kidding. That's all I have. That's all I have for you. We do offer a lot of other support, but that was the one I was asked to highlight. So that's what I have.
Thank you so much for coming and sharing that. We really just want to make sure families and people we serve know what resources are out there, what's available, because there are just so many different needs, and we're really grateful for like your inclusion of neurodiversity in this approach. And it looks like, can you put your contact information?
Yeah, absolutely. I was like, I didn't know if that was directed at me, but yes, I will. We do, like I said, we do offer a lot of other support as well. Kind of most of the humans that attend our support groups, whether they attend neurodivergence or not, have some levels of neurodivergence. So it's really nice to just have specific. That's my email. What other contact information?
It looks like someone just asked, how can people join, and how can we share this with people we know? Do you support Utah County residents?
So we do, actually. I would say at least half of the people that attend group come from Utah County. And so it was actually surprising to hear that when we first started doing the group, is that we got such a wide range. I've had people from Southern Utah. I've had people from, I don't know that I've gone any further than Davis County. We haven't gotten any Logan Pride humans yet, but.
So do they have to come into Salt Lake, or do you guys do groups outside of Salt Lake, or how does I think that might have been the question.
Oh, no, you're good. So we do not host support groups outside of Salt Lake, but we do offer a hybrid option for all of our support groups, minus our Alcoholic Anonymous and Narcotics Anonymous. You can't really do hybrid just for security reasons. But other than that one group, everything else that we do is a hybrid event. So if you are referring to people for registration, you can go to the website under a program. I think it's just listed as programs right now. They click on that and there's a registration link. I can also actually send you the registration forms link if you have people that you would want to refer to that way. And then what they do is they register, and it pulls up a list of all the different support groups for that age demographic that we have available. And so they'll click on all the ones that they're interested in joining. And then I get an email that says, hey, so-and-so signed up for these groups. I reach out to them. We do an orientation. I make sure they have all the contact information available for whatever resources they need, and then they're able to join groups from there. So let me pull up my registration link, and I can put that in the chat for humans. I can also send my flyer my flyers, I guess, for groups to the email for this meeting, and then you would all have access to that as well, if that's something that you would like.
Britt, if you send the flyer to me, I can include it in the resources that we post on the website with the recording.
Perfect. And then I can do that with the registration link too, if you'd like.
Yeah, that would be perfect.
Okay, let's do that. Are there any other questions about groups, or when they're running, or any way that the Pride Center can support what you all do. All right. Well, my contact information's in the chat. Don't hesitate to reach out. I get back to emails pretty quickly. So thank you all for letting me steal some of your time today.
Thank you so much for sharing your time with us.
Absolutely.
We're going to go ahead and move over to our general Q&A. And like I mentioned at the beginning, we've already had some questions come in. So we'll start with those, and then I know we've had some come up during the chat that I will have plenty of time to get to. So one of the questions we received is, I wonder if there's resources to help with getting guardianship for parents of adult disabled children. So the Utah Courts website provides general information regarding guardianship and conservatorship. So if you go to their website, and it's being put in the chat, there are links to all the necessary documents needed to file for guardianship. Also, Guardianship Associates of Utah offers classes to those interested in petitioning for guardianship pro se. So that, we're getting that link in the chat as well. And then the Self-Help Center through the court provides free legal help to individuals representing themselves. So that link is also being put in the chat. So hopefully that will help get you started. Our next question is, please describe what criteria might get a loved one on the DSPD services, not just waiting list. Our handicapped daughter isn't receiving any services from DSPD, but in 2 other states we lived in, we were immediately given respite care and day program services paid for. Plus, they share some personal information that kind of highlights a need. And express their gratitude to be able to have DSSI. So the home and community-based services offered vary from between states, right? State to state. Currently in Utah, funding for services is not immediately available. DSPD does try to offer one-time waitlist supports when it's possible, like such as what we're doing with ARPA. We also are typically able to do this if we have carry forward. DSPD does have a committee that reviews emergency situations. Our Emergency Services Management Committee meets at least once a month to review specific cases. When someone is referred, the situation is assessed to determine if there are any other resources available to them, just to be able to assure we're maximizing our funding and reaching the most urgent needs. Our ability to prioritize resources for urgent and emergency needs is really also contingent on available funding. We use attrition funding, so if someone leaves services, we'll use that funding to bring someone new into services, and that's reviewed through this committee. So the emergency criteria that go through this are homelessness. So if the person is homeless or in immediate jeopardy of becoming homeless, and they don't have, and their daily living skills and independent living skills are such that they wouldn't be able to care for themselves in the community without putting themselves in danger. So homelessness, loss of caregiver. This can be due to the death of a caregiver or a change in their capacity to care for their family member. And there are no alternative supports. It can also be related to severe behavior support needs. So the person is jeopardizing their own health or their family's health and safety, and they pose a grave danger to themselves or others. It could also be for severe medical support needs. The medical support needs jeopardize the person's health and safety, and there are not alternatives to meet their needs. And current medical care prevents the family from providing other necessary supports. And then abuse. So when Adult Protective Services, Child Protective Services, law enforcement, or the Office of Public Guardian are involved, they get referred here as well. So And then beyond that, people come into services based on most critical need. So as we received funding this year to bring people into services, 90% was appropriated to bring people into services based on the most critical need, and 10% was appropriated for people to come in to the limited supports waiver. That's part of a strategy to try to get services into people earlier and hopefully maybe prevent some crises. So that appropriation is funded, and the needs assessment questionnaire, that is how people's scores from that are how we identify who to bring into services. Our next question is, once I am approved for services, is there a way of tracking how much has been spent on my behalf so that I will be aware of how much could be recovered from my estate after I die? Along with that is the question, and can you give me details about how they determine whether a situation falls under the exception to estate recovery? So this is definitely outside of like DSPD's purview, but we are going to put a link in for the Medicaid estate recovery, their website, so that will be available. The Office of Recovery Services, we're also going to put their link, their Medicaid recovery information. We're putting their link in there. And then there is a website just with some general estate recovery information. But I would start with Medicaid and the Office of Office of Recovery Services, and hopefully they can help get answers to those questions. Or maybe you're able to even find those on the websites. So our next question is, why is the PA1 code for the physical disabilities waiver recipients about $4 less per hour than the supported living code for those on the communities-based waiver? It seems that those on the PD waiver are being treated less favorably or differently, although require a higher level of care than those on any of the other waivers. So for our waivers, the rates are initially established through a rate study based on the service description. And then they're increased as we receive appropriations from the legislature. So when there's rates that are funded, that goes straight into the rates. And in our system, it has been some time since there's been new rate studies. And this is an area that's currently being discussed to evaluate our rates. Another thing I would just add is that personal attendant services and supported living services have different definitions and different requirements, which would affect the rate that gets established. So personal attendance is limited to performing assistance with activities of daily living, and supported living helps to teach people life skills and independence. So there would be a difference based on some of that. A next question that is along the same lines is, why don't the physical disability waiver recipients have access to the homemaker, chore, companion, etc. codes? So really each waiver is developed to meet a particular need. And as a result, the services vary by waiver. We have, there are, I think, 8 waivers in our state, and they have been created for unique reasons. The next question is, why doesn't the PA1 code include laundry, shopping, heavy cleaning, meal prep, and cleanup, etc.? Again, it seems that those on the PD waiver are being treated less favorably or differently. So this is similar to what the answers to the previous two. So service codes have been developed based on the needs identified and the scope of each waiver. And then waiver services are reevaluated at least every 5 years. One thing to know about though that is that any changes that require funding or legislative action would need to go through the legislature to have that happen. As individuals, you can advocate for any needed program changes. The Disability Advisory Council is a place that you can bring that forward. The Medical Care Advisory Committee is also a place to bring that forward, or sharing that through the legislative process with a legislator, your representatives. And you can also reach out to the advocacy groups that we mentioned earlier, like the Utah Parent Center, the Utah Developmental Disabilities Council, and the Legislative Coalition for People with Disabilities. They all advocate for people with disabilities. They all have relationships with legislators, so that they're a good resource as well. Our next question is, what is the division's intent for caregiver compensation going forward? And then kind of sub questions, do you intend to continue it? And is the intent for caregiver compensation to be used in conjunction with other services, for example, respite, supported living, or in place of them? Thank you for providing the program. It has kept our family afloat. We have written to the legislature and taken the survey. So if you've already contacted your legislators and taken the survey, then you're on the right track. Caregiver compensation is currently funded by the legislature through June of 2023. We don't know if the legislature will continue to fund it after that, but the information from the survey you took will be communicated to legislators so they can make informed decisions about the program. We also know that the Legislative Coalition for People with Disabilities is actively gathering information and stories to share. So they're a great resource for you. As part of the executive branch of the government, DSPD can't advocate for any funding that is not in the governor's budget. And that budget typically comes out in December. And the intent of caregiver compensation is much like the rest of DSPD's services. All service usage needs to be based on the unique needs of the individual. For some people, that may just be caregiver compensation, but some other needs may need additional services in their plan. Where this gets a little tricky for us right now is the only thing that allows us to do caregiver compensation is still the Appendix K. So that is the amendment to waivers that allows us to provide services differently during the pandemic. And I know it's like been 2.5 years, right? It's a lot longer than we ever thought it would have been. So our Appendix K allows us to do this under the pandemic. And we know that there will be more work for us to do if it were to become permanent and ongoing differently. There are things that we'd have to address, like defining extraordinary care. Right now, extraordinary care is based on needing to adapt to pandemic circumstances. Right. So there are things that will need to be done. So just remember that that's where we have the authority right now. And so it makes it a little different than when you have a service that's in your ongoing waiver. So the next question is, has the state started taking people off the waiting list? We were in the first 100 and still have not received a phone call to get services. So we have started bringing people into services in small groups each month. And we've already assigned the cases for the August group, so you would have heard. One of the things that's different than in past years is this year, the legislature, they gave us a very generous appropriation, right? I think it's the highest appropriation I've ever seen given for the waiting list. And part of what they did, just recognizing that we need to be sensitive to capacity in our system and the ability of our system to respond. So part of that funding was reduced with the anticipation, I should say temporarily reduced, right? The whole funding will be there next year. This year, it was reduced by half with the anticipation that we're bringing people in across the year giving our system the ability to respond and meet people's needs, especially with kind of the recovery from the staffing shortages that have been experienced in our system over this past year. So instead of bringing everyone in at the beginning of the year, which we've typically done, people will be coming in like July through June. So that's a little bit different, and the funding was set up for us to do it that way. But be assured that when you roll over to the next fiscal year, like the full budget is there for an entire year of services for everyone that comes in. Then can someone share with us how many people are currently on the Utah waiting list and what the average wait time is? And is there a way to know where we stand within the waiting list? So the waiting list at the end of fiscal year 22 was at 4,346 with an average wait time of 5.5 years, so 5.5 years. To find out where you stand on the waiting list, you can contact your waiting list caseworker. If you don't know who your caseworker is, you can call our intake line. We'll put that in the chat so you have that. And if you are set up in My Steps, you should be able to see it there as well. The next question is there talk of caregiver compensation for adolescents? I understand it's only for 18 and up. I think so. I'm not sure where the information comes from, but I know that each state does it differently. There are some states who implemented it during the pandemic, but don't intend to continue it after. Some will only offer it for adults. In our state, as it stands right now, there is not a condition on the age, right? So it just has to be based on the person's need and meeting that need and the ability of the caregiver to meet that need. And when I say ability, it doesn't mean like your capacity as a parent. It's like full-time work, other obligations. Like if you're also taking care of a parent, there's paperwork and documentation that has to be managed, right? So there has to be that capacity as well. So right now it's open. In our study that was provided to the legislature, it did break down like what it would look like if they chose to support caregiver compensation for spouses, for like if it were just people of a certain age, right? So it kind of broke it down that way. But as it is right now, with our Appendix K, it does not limit it to just 18 and older. Those are all the questions, I think. So those are all the questions that we have, both from before and that have come in, unless we missed something in the chat. Just see if there are any other questions. You can feel free to come off mute. And if you have a question in Spanish, we do have someone who can translate if you need that.
Hello, can you hear me?
Yeah.
Okay. I just have a question. So if we do come off the wait list and we have a place that, like my son's going to a center, how does that work? Right now I'm paying for that service. So how does that work when he does come off of that?
So you would set up a plan, and it sounds like that's a need if he's attending, right? So and if it would, for us to be able to, like for DSPD, like waiver services to be able to support that, they'd need to also be contracted with us. So the plan would be set up, and then if his day supports were part of that, right, that would be part of his budget.
Okay. Is there just certain places that you guys are contracted with, or is there a list?
We do have a list of our contractors that you can look up on our website. Like if you select, we have a map and you can select the area that you're in, and you can look up who provides services in that area for the type of service. I'm just trying to think if we have a faster, easier way. Oh, look. So Emily put the link in there, so that should take you right there, and you'd be able to look at that list and hopefully see if that provider contracts with us or not.
Okay. When you do get that, does that provide transportation as well, or is transportation separate?
So they're two separate services. So if you come off the waiting list and you do your assessments and you do your planning, that would all be part of what you're talking through. Like, do you need transportation to a place? What are those needs? So it is a unique service from the day service.
Okay. Thank you.
Yeah, you're welcome. And it looks like I may have missed an email, so I'm gonna quickly check. To see. So I don't have any questions from Jeanette. I just did a search. Let me try it.
Angie, it's in the DSPD info.
Okay. Thanks. Are they questions that we already captured? Katie?
No.
Okay.
You can
Yes, I had a question. We have a sister that we admitted to a nursing home, and it's my understanding that her DSPD waiver expires around the 22nd of August. Would it be possible for us to bring her back to her home and continue with DSPD?
So it sounds like she has services right now, has had a temporary stay in a nursing home.
Yeah,
I mean,
she's in the nursing home at the present time, but we just feel like she's not getting good care at all because she's lost like 20 pounds and she's just digressed horribly.
And so she still is set up for DSPD services?
Her service is still open, it says. Her case is still open for DSPD. It was our understanding that she had 90 days after she was admitted
Right.
on DSPD.
Right. So you should, it might be easiest. I can probably just have someone contact you. Will that be okay? If we just use your email and have someone reach out to you to kind of walk through that and make sure we have everything in place?
Yes, would you like my telephone number?
You know what? We'll go ahead and reach out to your email so that you don't have to share your phone number with such a big group.
Great.
Okay.
I really appreciate your help. Thank you.
Yeah. And thanks for catching that.
We're
and
just,
bringing it
we're
up.
getting concerned because we're getting to the end of her eligibility, which I think the 90 days expires August 22nd or something.
Okay. So yeah, so we'll want to make sure we reach out to you right away so that we can.
And we also need some assistance in stating a fiscal agent because we were with Leonard and they are no longer available.
Okay. Yeah, just kind of how you had help getting everything set up initially, you'll get that same kind of support to get things set up again.
Okay. Thank you very much.
You are welcome.
Okay, I entered my email in the chat if you need it. I don't know.
Okay. Okay, thank you.
Bye-bye.
Bye. And it looks like Brenda, that like Utah Parent Center can help answer your questions about Social Security. And they're a great resource just for so many things, whether it's in education or that transition. Everyone who works there has lived experience, and many of them have had to navigate this, right, the different systems, and they're really a great resource. The question about judges putting special needs people in danger by awarding visits by people who sexually abuse them. I feel like I'm going to have to probably get more information on that. We we obviously don't dictate to the courts how they operate, and I wouldn't know anything about this, but I'm wondering, we could probably have someone reach out to you to see if they have information that would help, or see if there's information that the judge could benefit from receiving, or so we can have someone reach out to you on that. Okay, so the caregiver compensation form that has closed, and we're already analyzing the data. So, so that's not available to participate in still. Question on caregiver compensation about being able to be paid. So caregiver compensation does have a cap of 40 hours per person. So for the person receiving services, one parent could be paid up to 40 hours a week, or two parents could be like 20/20, but it's still a 40-hour cap for the person receiving services. And it's really, the amount is based on the need of the person. So that would be something that you're developing in your plan, and it would be looking at just making sure it's the right service for the person, looking at what else is available, right? So it's making sure we're doing a full look to make sure we're best meeting the needs of people. We have like lots of people helping provide SSI information, so I hope that you're following that. I don't, and then do others have this problem with court rulings? I sincerely don't know, right? Because that's not our that's not where we provide services and support, and we don't make those decisions. So I really don't know. Okay. Looks like there are no other questions. I just want to say thank you so much for participating. Thank you for your time. We think it's really valuable to hear from families and from people we serve where they're at and what their needs are, as well as make sure we're sharing information with you so that you can stay informed and involved and updated. So thank you so much, and have a great day.